in children, the leukemias are always aggressive. So you have to pick up those leukemias as early as possible and treat them accordingly. Most of them are having heritable mutation that comes from their parents, and once they add up with another mutation, they start developing the leukemias. Most of the childhood cancers, the risk factor lies in their utero. So once they are in utero, in the mother's womb, so mother is exposed to many risk factors like this, are exposed to infections, airborne pollutants, or benzene salts, or polyaromatic hydrocarbons like in the form of smoking. So child is failure to thrive, he doesn't eat anything, and he may develop signs and symptoms of weight loss, and he may develop excessive sweating, or sometimes they can develop bleeding from gums, from nose, or there'll be red spots on the skin, which we called as that actually bleeding in the skin. They can develop small nodes on the neck or inguinal region, or there is bloating of the abdomen, which is because of the fluid that accumulates in the abdomen, or because of the liver enlargement or spleen enlargement. First thing, the abnormality will be there in the complete blood counts, that's hemogram, what we say. So that is available everywhere. Blood chemistry, then we do bone marrow investigations, and on that we do flow cytometry, we do cytogenetics, and fluorescent in situ hybridization tests. That will tell us about the risk stratification and type of the leukemia, because the treatment is personalized. Leukemias are treated with chemotherapy, and sometimes we may need radiation if the disease is at a critical point, like it is in the vertebra where there is a chance of spinal cord compression. Chemotherapy is basically the backbone treatment for all leukemias, and plus minus bone marrow transplant. So we do here allogenic bone marrow transplant for cure of those leukemias. If we talk of the leukemias, if within first 5 years they remain okay, so the chances of relapse are nil. So if chance relapse comes, it comes within first 3 years, most within first 3 years. The relapses are around 20-25 years. Childhood cancers are very well treatable disease, and you can cure it and you can conquer this type of cancer.